This video will show you how to measure for and order a made-to-measure compression therapy garment from the industry's premier supplier, Gottfried Medical. To measure for an arm sleeve or gauntlet, you'll need Form A12A W3, the Gottfried Medical measuring paper tape labeled ARM, a sanitized cloth or disposable measuring tape, and transparent tape. Timing is critical when measuring for an arm sleeve. Swelling needs to be at its lowest and kept under control until the patient or customer receives the support. Have them sit with the arm extended to the side and the hand, palm down, resting on a stable object. Place the spine of the tape along the top of the arm, with the highest number strap near the shoulder. The anchor point for the arm sleeve is the 9 strap. Wrap this strap around the elbow crease and fasten it securely with transparent tape. Work toward the wrist, making the straps as perpendicular as possible to the spine of the tape. The straps should be snug against the skin, but not so tight as to cause the skin to bulge. If they are heavy, gently pull the tape in until reaching a firm point. It may be necessary to lift up loose flesh, causing some bulging between the straps. Use Gottfried Medical extension tapes if necessary. The 0 strap should fall slightly below the wrist bone where the wrist bends. If the 0 strap falls short of this point, use the 1.5 strap for the wrist circumference. If the 0 strap extends past the wrist, pleat the tape as needed, keeping the spine in a straight line. Secure the pleat with transparent tape. Then work from the elbow up. The last strap should end approximately 1 inch from the underarm. To add an adjustable shoulder flap to the arm sleeve, have them lower the arm to the side. Then measure the length from the last strap at the underarm, up over the shoulder to within 1 inch of the base of the neck. Record this measurement in Box A on the order form. There are 2 ways to anchor the shoulder flap. To anchor it under the opposite arm, measure the distance from the center tip of the shoulder to the center of the opposite underarm. Record this measurement above Box C. To anchor it at the waist, measure the waist and the diagonal distance from the center of the shoulder to the opposite side at the waist. Record the measurements in boxes B and C. When you're finished measuring for the arm sleeve, lower the arm and confirm that the last strap ends within 1 inch of the underarm and does not roll out. To remove the tape, cut the straps on the scalloped side of the tape spine, below the strap identification numbers. You can either enclose the tape with the order form or record the measurements directly on the form. Take the measurement from the straight edge of the tape. For example, the circumference of the arm at the 9 strap is 9 inches. On the form are numbers that correspond to the straps on the arm tape. Record the measurement in the box beside the 9. Wherever there's a pleat, measure the distance between the center lines of the 2 straps that are now closer together. Record it on the form between the numbers of the appropriate straps. For example, the pleat between straps 10.5 and 12 measures 3/4 inches. If the patient or customer's arm is contracted, the procedure is slightly different. Lay the spine of the tape along the top of the arm and form it into the same angle as the contracture. Wrap the 9 strap at the elbow and fasten it securely. Pleat the inside edge of the spine between the 9 strap and the 2 adjacent straps, 7.5 and 10.5. Measure the distance between the center lines of the pleated straps and record it on the order form. Be sure to indicate the degree of contracture. Gottfried Medical offers several options for arm sleeves: a zipper to make donning easier, an inner elbow lining to help ease chafing, and a flex seam at the bend of the elbow to eliminate bunching of the fabric when the elbow is contracted. Remember, when measuring for an arm sleeve, make sure swelling is under control. Start with the 9 strap at the elbow. The 0 strap should fall at the wrist. The last strap should be within 1 inch of the underarm. For a contracted arm, pleat the inside edge of the tape on both sides of the 9 strap. For all compression therapy prescriptions, correct fit and pressure are absolutely critical. Only made-to-measure supports and garments can provide that kind of precision. And that's why healthcare professionals rely on Gottfried Medical. If you have a question or need assistance of any kind, our technical staff is just a toll-free call away and ready to assist you. Compression therapy is of great benefit in treating patients or customers with vascular or lymphatic conditions or scar-related injuries. Gottfried Medical made-to-measure products, with their superior fit and broad range of options, bring them a new level of comfort, convenience, and physiologically sound therapeutic effect.